Good morning, Dr. Berger.
Good morning, Irina.
So, there is a lot of information right now about anti-aging drugs, and especially we heard a lot on the concierge medicine forum that was recently held in Atlanta, metformin as well as rapamycin. Can you talk a little bit about those anti-aging drugs?
Of course, yes, there is a lot of discussion in both the scientific community and in the public uh, venue regarding anti-aging medications in general, and these two in particular, rapamycin and metformin. Rapamycin is a fascinating compound. It has a really interesting history discovered on Easter Island called Rapa Nui by a Canadian researcher just collecting soil samples. It was found to contain this compound that would inhibit fungal growth, and then that eventually became rapamycin and used as an immunosuppressive agent in organ transplant patients. However, in mice, it's also been found to extend life of middle-aged mice. There are trials showing that in low doses in a pulsed kind of dosing pattern, this is the Pearl study, that it's likely safe. Research is really hot and ongoing with regard to rapamycin. So possible longevity medication, geroprotective agent in the future, lots of research ongoing. It's immunosuppressive, so it can decrease the ability of your immune system to fight infection, can even lead to sepsis. And it can it also cause issues with metabolism. So definitely something to discuss deeply with any of your medical providers before considering. Metformin has been around for decades as a diabetes treatment, originally derived from the French lilac. And so we have very good safety data for it. It does tend to have the side effect of gastrointestinal distress, possibly diarrhea. They are enrolling for an anti-aging study with metformin called the TAME trial. This will be a 6-year-long study to take a look at it at the 1,500 milligram per day dosing level. Should be a very interesting study, a very comprehensive multi-center sort of trial. So we should get some very good data from that on metformin. But again, it is a largely safe medicine, and it's been shown that people with diabetes who are on metformin may have increased lifespan compared to people who are not on metformin and don't have diabetes. So lots of work going on with both of these medications, rapamycin as well as metformin. It's going to be a really hot topic in the research world, and something you can discuss with your physicians and continue to tune into us to learn more about. So remember that everything we provide on these kinds of videos is for educational purposes only. It does not substitute for medical advice, and no doctor-patient relationship has been formed. If you'd like to speak to your healthcare providers, you definitely should with any questions or concerns you have about your health. If you'd like to talk to us and learn more about what we do with regard to lifespan and health span through lifestyle management and also weight control, please call our office, Northeast Medical Practice, 516-604-3418, online at northeastmedicalpractice.com, all our social media channels, and our Longevity MD podcast on Spotify. So with that mouthful completed, we'll see you again soon, and be in good health.
Thank you.